Okay, just a bit of housekeeping. Patricia, are we now live?
Yes, we are on Facebook.
Fantastic. And I'm guessing that I am audible. So, hi Grace, good evening, how are you?
Good evening.
Good to see you. So, hi, I'm Dr. Aisha Bianca Edwards-Remy. I'm the head of clinical services here at AAR Hospital. I will, however, turn off my camera. Grace, I'm so sorry, as I introduce our speaker for today. So for those of you who are not aware, the 3rd of March is World Hearing Day, and the theme for this year is to hear for life, listen with care. So today I'm joined by Dr. Grace Mwangi. So Grace holds her bachelor's degree and her master's degree from the University of Nairobi. She has a keen interest in head and neck surgery and otology. She has attended several Operation Eardrop surgical camps that aim to provide preventative, surgical, and rehabilitative services to Kenyans with hearing problems. She's a registered member of KENS and has over the years done regular scientific presentation. She loves to travel and look forward to a new normal, traveling in this COVID era. Grace, welcome, good evening. Grace will be presenting to us a healthy ear. Karibuni sana daktari.
Thank you so much, Aisha, for this opportunity, for giving me this opportunity to highlight on some of the few things that are cropping up, especially on this World Hearing Day. We commemorate this day on the 3rd of March of every year, according to WHO. But World Hearing Day has been there for some period of time, and every year we have different themes. As of today, what I will be basing my presentation on is basically to give you an idea of what is known as a healthy ear and measures that you can follow that will help you ensure that you have a healthy ear throughout your lifespan. So I will go ahead and share my screen. Aisha, can you see that?
I can. Can you please put it in presentation mode? Fantastic. It's good.
Okay. So I'm Dr. Mwangi Grace, and as I said, today is World Hearing Day. One of the few things that you should know is that the impact of hearing loss in the world is great. Unfortunately, hearing loss is something that is, It's something that is quiet, so that you never see anyone come, something physical that they can't hear. And it impacts greatly to not only the young people, but also the older people. And 60% of the children who have hearing loss, it's due to preventable causes. The current theme this time is more based on noise exposure, and it is aiming to target young people. And what is of note is that 1.1 billion of young people are at risk of developing hearing loss as of now. The benefit of knowing about hearing loss is so that you can have early screening, early detection, so that we can also intervene early and rehabilitate people so that they can be integrated within the community. As I said, is that hearing impairment is invisible. That if I was to be standing over here and I cannot hear what people are saying, you would never pick that. It's not something that is physical. So unfortunately, it's also a disability that can go unnoticed and overlooked. Impact of this is that it can impact psychologically, even on the patient. They tend to become withdrawn. They are not well integrated in the community, so they tend to miss out on job opportunities. And for the ones who have job opportunities, they tend to have on the lower grading of employment rather than what is expected with regards to someone who has normal hearing. So a lot is overlooked when it comes to hearing impairment. So this year, the theme is to hear for life and listen with care. meaning that if you want to have normal hearing throughout your lifespan, you have to have careful measures that will protect your hearing. And this is possible. And what you need to do is to ensure that you are reducing your sound exposure. Aging is dynamic. It's something that is unavoidable. And with aging, also the ear can age. However, the aging of the ear can also be influenced by other factors such as loud noises, recurrent infections, or even use of drugs that can be damaging to the ear. So safe listening just means that you want to reduce the risk of hearing loss that is associated with loud noises, and especially in this era of recreational sound exposure. So there are so many stakeholders that are being involved. And currently it's more of the government, entertainment owners, the entertainment joint owners, so that we can be able to reduce the levels of noise and also the duration of exposure. A little bit of background, just a little snapshot of how the ear looks like. So the ear is not just basically what you see outside, what we call the pinna or the auricle, but there's also the canal up to the eardrum, what is referred as the external ear. The middle ear is a space behind the eardrum that contains air and the small bones of the ear. And it has a small connection to the back of the nose through a small tube known as the Eustachian tube or a pressure equalizing tube. Then there's what is known as the inner ear, where we are able to change your sound waves into an electrical signal that is now sent towards the brain. It is important to note that the ear does not only serve the purpose of hearing, but it's also responsible for balance. And that's why hearing loss is not only what you can present with, but you can also have what is known as dizziness, what people call vertigo. So what are some of the things that can tell you don't have a very happy ear? So one of them would be hearing loss, which you can deduce by saying that there's reduced hearing or there's no hearing at all. You can have an itchy ear, you can have ear pain, you can have ringing noises. So this is something where you experience a noise that other people are not able to hear. You can also have a discharge. Discharge can be as simple as clear discharge, pus discharge, or even blood. Then what I had said, vertigo, which is now dizziness that is coming due to an issue with the inner ear, where that is responsible for balance. The ear in itself has measures to try to protect itself. And I brought this one up because there's this misnomer of wax is dirt. And we always say uchafu wa masikio. But that is a misnomer. Wax production is a normal production process. There is glands that everyone has that is supposed to produce this wax. Wax in itself tends to be acidic. It tends to repel water, and it protects the canal, which is the skin of the canal, from infections. It even has antibacterial effects that can prevent even infections. In as much as we know that the ear is producing wax, it also has a self-cleaning mechanism. So with that, we don't need to go digging out wax in our ear. We're supposed to just wipe the external part of our ear. In ENT, we have a rule that if your elbow can get into your ear, then you can put anything. In other words, please do not put anything in your ear. Wipe the outside, leave the rest. It's normal. And a study even done in Nigeria was actually trying to deduce what people use for clearing of wax. So most people use cotton buds, of course, but you can actually see the other crazy things that we use. Biro covers, because you want to scoop things. When we say multiple objects, I've even been told about toothpicks. We've been told about keys, anything that is projectile that can get into the canal in an attempt of scooping out wax. Now, these are things that are not supposed to be there because we've said the ear has a self-cleaning mechanism. However, our ears are not the same. Some people have smaller or rather narrower canals than others. Some people will have more wax production compared to others. They might be slow release or rather slow cleaning mechanism, you might find that the quality of wax changes from one person to another. That there's some people who might have very light wax and some people have sticky wax. So for a person who has a narrow canal, produces a lot of wax, has slowed self-cleaning of the ear, especially with age, you have the risk of developing what is known as wax retention in the ear. Wax being retained in the ear is not painful. The only thing that it does, it causes blocking. Blocking means that it's going to have an impact to your hearing level. So you might have a temporary reduced hearing. So if that's the case, that's the time we say that you're supposed to undergo what is known as ear irrigation, or what we say ear cleaning. In these pictures, you can actually see what happens if you put a cotton bud, that you can simply push it further in and block the canal, or there might be accidental injuries of it even going into the puncturing the eardrum and getting into the middle ear. So please do not use a cotton bud, wipe the outside. When I say cerumen, it's just the ear drops that are usually prescribed, and these ear drops are actually wax softeners. Wax softeners just making the wax a bit more soft in an attempt to even make it easier for self-cleaning, or even in preparation for cleaning of the ear. Unfortunately, there is no drops to stop the wax production, because it's something that is supposed to continue, because you still require the wax. So there's nothing like, let's stop wax production. You still need it, the drops, as for softening in preparation for cleaning. It was known as the World Report on Hearing, and this was launched in 2021, and it aims to intervene on hearing losses through 7 measures, and it's after the mnemonic hearing. And what is of note is that, as you can see, what is highlighted over there is noise reduction. This is what is being targeted in the World Hearing Day in 2022. And what we're aiming for is screening early and intervening early. We want to prevent and manage ear diseases early. We want to make sure that people have access to technology, both for diagnosis, screening, and also for intervention. Rehabilitative services, meaning that if you have a hearing loss, it doesn't mean that you cannot be rehabilitated. So that we aim for improved communication, and we also have the greater community being engaged in this. So World Hearing Day in 2022, we are aiming more on noise reduction. And some of the things that you can do is by reducing the volume. You can use protective devices such as earplugs or what we call earmuffs in very noisy surroundings. You can try to reduce the amount of time that you expose yourself to loud sounds. Then there is, with our smartphones, there is what is known as noise meter apps. So that you're able to screen how loud a sound is, so that you know which are the dangerous levels at which you can start getting hearing loss, and actually away from that kind of a noise. And it's always good to have regular hearing checkups, just the same way you do a full body checkup. Please don't forget your ear. This is a spectrum that is just generally showing you day-to-day activities and what is known as, can I say, safe levels of hearing, as they actually go to levels that are destructive. And what you notice is that as you are approaching the road traffic, it's already levels that are not safe. So they're already unsafe. So the higher the, can I say, the volume, which we measure in decibels, the worse the hearing loss, or the higher the risk of hearing loss. And also, the longer the duration of period that you're being exposed to this loud volume, the higher the risk of you developing hearing loss. So if you're a person who likes going to the nightclubs all the time, you can actually see you are getting to exposures of around 100 decibels. And when you are intoxicated, I think some of the safety measures get forgotten. So you spend a whole night over there with these high levels, and the next day you're wondering why there is a ringing noise in your ear. There is already wear and tear of the inner ear. So the inner ear has these sensitive sensors known as hair cells that will bend and break and damage due to these high sounds. And unfortunately, these hair cells cannot regenerate. They cannot regrow again. So with noise-induced hearing loss, you tend to have irreversible hearing losses. So it's much better you protect yourself from these high levels rather than ending up with irreversible hearing loss. So permanent hearing loss, unfortunately, that occurs with noise-induced hearing loss, it can be of sudden onset. That if, for example, in a bomb blast, many people in 1998 actually were able to get this kind of a hearing loss of sudden incident because of that acute loud noise. Then you can have what is known as prolonged noise exposure, that the levels are not very high, but they are unsafe. And if you're exposed for a long period, it is enough to have damage to your ear. You should need to know that there's what is known as occupational hazard, that the people who work in, let's say, for example, the steel industries, textile industries, and they have this monotonous high sounding machines, that is already a risk factor. People who work in telecommunication, so if you're always using your earphones and you're always there for a long period of time, it's good to know that this is something that is making you at risk of developing hearing loss. Border riders, you can imagine how loud our borders are. Juakali artisan, this has studies have been done on Juakali artisans, and they have been noted to have hearing losses later in life. Then there's what is known as the recreational noise, where you find people going to entertainment spots, listening to very loud music, fireworks now during the celebratory times, and then you end up with acute incidents of hearing loss. In the event of Corona and COVID, and we had all this new development of virtual platforms, and everyone was embracing this. Then there is resultant excessive earphone use. And also you have to take in consideration when there's technical hitches, that you can be having your earphone on, and then there's a loud noise, someone is on high volume, or probably something goes wrong and there's a sharp noise that comes from our laptops. So these are things that you need to understand, that when you are having these virtual meetings, like for example, what we are having right now, it's much better when you're not using earphones, you're in a quiet room and you're, reducing the volume. And if you're to use earphones, that person next to you should not be able to hear the sound through your earphones, because that is too loud. So what is too loud? If you have to shout above the noise, if you're in a place and you have to shout above the noise, that is too loud. If someone is 2 feet away and you cannot understand what they're saying, you're already in a noisy place. And if someone is standing next to you and they can already hear the noise or the sounds that are being transmitted in your headset, then that's too loud. So these are simple things that can make you aware that I'm already in a noisy environment. Then there's what is now prevention measures. There is sound meter apps that are in our smartphones that are able to measure high decibels and tell you, are you in an unsafe area or safe area? Then you can always reduce the volume of whatever you're listening to. Do not try to, muffle out noises. Like for example, if you are vacuuming and you want to listen to the television, do not increase the volume of the television so that it overcomes the sound of the vacuum. You are already exposing yourself to loud volumes. Then there's what is known as hearing protecting devices, such as ear muffs. This, we see them a lot in the industries, or even people who work in the airports where they are wearing their ear muffs. There is earplugs. They are quite inexpensive. They are readily available even in the pharmacies, which you can wear, and they're able to actually reduce the kind of noise or volume that is being transmitted into your ear. Then the lesser the duration of exposure, the better for you. So if you're in situations where you have gone for a concert, you might as well limit the duration of time that you're over there. So this just guides you. Like for example, if you have a screen, a hearing meter screen, and you can see that I'm already exposed to sounds as high as 85 decibels, which can be in traffic. If you're in that traffic for a period of 8 hours, this is now approaching limits where we say this is not safe. So the higher the decibels or the loudness of sound, the lesser the duration of time you're supposed to be in that kind of sound. So this is just a representative chart that can guide you on what is safe limits to which you can be exposed to these volumes. One thing that is dynamic is aging, and we embrace it. And with aging comes in a lot of wear and tear. Our ear also ages, and so we usually get what is known as presbycusis or age-related hearing loss. However, if you do not want to escalate how fast you get this hearing loss, or if you don't want to increase the hearing loss levels, then you need to protect your ear, that you need to reduce on the noise exposure so that you do not have a combination of factors that are reducing your hearing and yet you are aging your ear. You don't want to be in a situation where you are old and you find that the elderly, they tend to be a bit angry. Not that they want, it's because of the cognitive effect that they have when they have a hearing loss. They don't want to bother someone by asking them to repeat things. They feel left out in conversations. So you want to rehabilitate them by making sure first you protect your ear. And if you have a hearing loss, then seen early so that we can be able to rehabilitate you. When we say rehabilitation, there are so many ways of interventions. There's some people who will be rehabilitated by, if it's an infection, do your treatment early. There's surgeries that can be done, such as clearing of disease or even use of cochlear implants in an attempt of restoration of hearing. Then there is the rehabilitative devices such as hearing aids. I'd like to say that hearing aids have undergone a lot of changes. It doesn't have to be a bulky looking hearing aid. There is what is known as analog hearing aids, and there's the digital hearing aids. Then also, depending on how it looks, there's the behind the ear, in the canal, completely in the canal. So they go becoming smaller and smaller, and they are able to even connect with our smartphones. And so these are things that have actually undergone through the different generation of hearing implants. There's a lot of stigma and resistance that comes with hearing aids. A hearing aid does not change your level of hearing. It amplifies that. If you have already reduced hearing, you are able to amplify that sound to what is normal levels of hearing, and you can hear as good as anyone else. It does not have an impact in terms of long run reducing your hearing. So these are things that you need to counsel people so that they are able to embrace hearing aids. So many people will buy hearing aids and they will put them in drawers. It is not helping you in any way. Other modes of communicating is the use of sign language. Sign language is as a language enough as English, Swahili, everything of the sort. And when it comes to captioning devices, for people who have a hearing loss, especially with these virtual platforms, they have introduced captioning where you can have a speak to text kind of translations, where I would be speaking and then automatically it is projected as text. And for someone with a hearing loss, then they can actually be able to follow up during the virtual meetings. This is just a summary of little things that you can do to try as much as possible to ensure that your ear is healthy. When I say medicinal oils, it doesn't mean you put your oils over there. Most of the wax softeners tend to be oil-based, and they are for softening in the presence of wax accumulation. Do not use cotton buds. We've said that the only thing that should be done is wipe the external part. There should be nothing that is inserted in your ear. If your elbow can get in your ear, well, and please do whatever you want with it. And since we know that it's not possible, please do not insert things in your ear. Prevent water entry, especially during the holiday time. You don't want water to get into your ear. You're swimming outside over there, you get a wet, damp ear, you're more predisposed to infections. And if you have that as a recurrent issue, even use of earplugs prevents these infections. You want a dry area when it comes to your ear, and reduce the volume of your headphones. That is quite important, especially in this World Hearing Day, where we are targeting noise exposure. Thank you and Happy New Year.
Thank you very much, Grace, for such an enlightening presentation. At this point in time, we'd encourage our participants to either ask their questions in the Q&A section, which will be manned by Dr. Wambui, or in the chat, where I'll be reading from. And also for those who are live on Facebook, you can actually make your comment, feedback, or ask your question on that platform. So we'll start off with Patricia. Is there any questions, comment, or feedback from Facebook?
Yes, Dr. Aisha, I have one question that has come in that asks signs my child could be having a hearing problem. How do I tell if my child is having a hearing problem? Thank you.
So that's important. One of the things I wanted to point out is that I know I gave a very basic presentation of what is known as a healthy ear. Now, when it comes to hearing losses, especially in children, it's imperative that we're able to pick up hearing losses early so that we intervene early. Reason being, it's that a child learns how to speak according to what they hear. If they do not get sound stimuli in their brain, that part reduces in function, and you find that the child has delayed speech. So one of the ways to find out is speech. Delayed speech can present in many ways. For example, by the time the child is around 3 months, 4 months, kids will babble. Babbles are when they say gigi, they will have their own mumbles here and there. That's actually a stage of hearing, a stage of speech development. So let's say, for example, if you notice my child is not babbling, quite quiet, that's already an issue. And unfortunately, in our situation in Kenya, some kids can go long unnoticed. Reason being, you wait until probably the child is around 1 year, you are blaming it on keeping the child in during the COVID season. The other thing people would say is that my child doesn't go out and get integrated with the other children, so they don't hear what the other kids are saying. Or it's a boy child. I don't know why in Africa we keep on saying the boy child is slow in development, because then you find a boy child might end up being presenting late with delayed speech. So delayed speech is one thing. Now, the other thing is response to sound stimuli. That your child, even if the child is around 2 years, if something breaks in the house, or if there's a loud bang, if you call the child, there's that sense of recognition. It might be a startle, it can be a look towards you. So this kind of response to sound stimuli already tells you the child can hear. Now, in the presence of a history of hearing loss in the family, that there is a genetic or a predisposition, or there's a family history of hearing loss, then it's important to do what is neonatal screening. That if you have a genetic history of hearing loss, that can be propagated down. So those are the children you want even to do neonatal screening. In developed countries, neonatal screening, or what we can say screening from even birth, is almost done as it's a must, just the same way you undergo vaccinations. And this can be done with non-invasive, very quick tests to tell you whether an ear can hear or not. So one of the other things that is neonatal screening. And neonatal hearing screening, as a parent, you can actually ask for it, because in the national government, it has not been put as a mandatory measure, but it's available. Unfortunately, probably public awareness, that's why we are bringing up that neonatal screening is one of the things that you should be aware of, and it's available, and it can be done on your child even at the age of 1 day, and you're able to know whether your child is hearing or not.
Thank you very much, Grace. Wambui, on your side, do you have any questions?
Yes, I have a question here from a parent. I know you had mentioned it a bit, but her child keeps on complaining of recurrent ear pain or ear infections after swimming. We talked about earplugs. Are there other ways that a parent can prevent this? And two, also, how does a parent know if their child has this ear infection?
Okay. So I'm first happy that the child is able to voice their problem. One of the other issues when it comes to the ears is recurrent infections. We're in a developing country. As I said, an unhealthy ear is not all about a hearing loss. You can have an ear discharge. And most parents will really rush when they see pus coming from the ear. But as long as the child is voicing ear pain, that's already something that the doctor needs to find out, why is the ear pain there. If your child is young, they might not voice out ear pain, but you might notice a lot of ear tagging or irritability. Then this is something that should also make you go to the doctor. When you talk about recurrent ear infections, when especially I pointed out on moisture and water exposure, there's what is known as a swimmer's ear, that every time when you go to swim, you can get an external ear infection. For children who tend to have external, even adults, recurrent ear infections of the external ear, you want to make sure that it is treated completely and you're able to revert to the normal environment in terms of the ear. That you're treated, make sure that all the debris, when I say debris, when the ear is infected, you might find that there's dead skin, there might be some pus that was retained. All that has to have been cleared out. So you see, especially that is cleared out, then you get the appropriate medication. Follow up to make sure that it has been cleared. Because sometimes you might have what is known as a half done clearance, that there's no pain anymore. There might be some little itchiness, but the infection has not completely cleared. So making sure that you're treated to completeness. But if you keep on having recurrent ear infections, then you probably want to invest on some ear plugs. Especially for kids who are even professional swimmers, you cannot tell them they should not swim. So you get them earplugs that will help them reduce. And they come with what is known as bandits. So bandits, it's something like a band that can be able to even hold the earplug better, so that you create a seal within the canal and water cannot get in. Yes.
Thank you, Grace. A question on this side is, I've had a ruptured eardrum. Will this affect my hearing in the long term?
So I feel like there should be a whole topic on hearing losses and causes. But when we talk about hearing losses, there is actually two types of hearing losses: conductive and what is known as sensorineural. When we say conductive, it just means anything that is interfering with how the sound wave is coming from outside up to get to the inner ear, where it's able to be transmitted to the brain. So for you to have normal hearing, the sound wave is like a wave that enters your ear. The eardrum is almost like a flappy thing that is like a flag. So if that sound wave comes and is able to transmit those waves, it goes to the middle ear. If you have a perforation or a hole of your eardrum, and there's so many things that can cause a hole in the eardrum. One of them is recurrent infections that can destroy part of the eardrum. And another thing is trauma, that you can easily injure it, whether it's by something projectile, whether it's even a slap, where you create very high pressures and it causes a perforation of the eardrum. Then it means you have interfered with the normal pathway of hearing, that your sound waves might not be optimally transmitted inside. So you need an intact eardrum to successfully transmit the sound waves fully. So you will have a hearing loss. It might be reduced, but the bigger the hole, the bigger the hearing loss. So when it comes to management, unfortunately, perforations are not treated by drops. You will clear the infection, but you will still have the eardrum perforation or the hole. Then that one needs what is known as a surgical repair, what we call tympanoplasty, which is, I usually say it's almost like a patchwork to seal that eardrum perforation.
Thank you so much, Dr. Terry. Another question that's coming in, there's a new trend on Instagram of people waxing everywhere, including their nostrils and their ear. What are your thoughts on the same?
So waxing, I don't know why we want to get rid of all the hair, but anyway, it's good. For waxing, I believe, and there's different kind of waxing. So there's the waxing where you really just want to put some wax, get rid of and pluck out the hair. There's actually people who practice something known as candle wicking, which is a bit dangerous, where you find they're putting a candle and then they're trying to get some heat to generate some of the dirt to come out. And we've had incidences where we've had burns of the eardrum and the canal because wax entered and it was hot and was able to cause a burn. Please, you don't need to do that. If you are waxing your ears, the only thing is that you need to understand, as I said, do not introduce anything within your ear canal as long as your elbow can't get inside there. Immediately you introduce wax over there, and when I say wax, I believe this is like beeswax, the wax that they used for waxing, then you can easily either burn the ear canal itself, or you can actually retain part of the wax inside, and now it becomes what is known as a foreign body, which will eventually be cleared out. And remember, in as much as you are plucking out those hair cells over there, they will regrow. They might be less, but they will regrow.
Thanks, Dr. Patricia. Any further questions, comments, feedback on Facebook?
Probably Dr. Grace can tell us further. There's somebody to
Sorry, I didn't get that.
Can a hearing problem be hereditary?
Can a hearing problem be?
Patricia, can you repeat the question from the beginning?
Can a hearing problem be hereditary?
Yes. Let me just give a snapshot of causes of hearing loss. There is hearing loss we say that is congenital or you are born with. And there's what is known as acquired. Acquired meaning that something went wrong and you actually developed a hearing loss afterwards. When we say congenital, there are several things that can cause congenital. For example, what I said, if there's a family history of hearing loss, then it means that there's something wrong with the genes that can predispose someone to actually be born from the word go with a hearing loss. The other thing about congenital, there is what is known as maternal infections that can actually interfere with the development of the hearing part for the child, unborn child, and result to a hearing loss. So by the time that child is born, already has a hearing loss. There's other risk factors for prematurity. Children who are born before term, there's a higher risk of them developing hearing loss. And that's why you might find that preterms tend to undergo something is supposed to be available for all children, preterms or not preterm. Very low birth weight. Of course, very low birth weight is associated with prematurity, but even if it's not associated with prematurity, you might find that low birth weight is also another risk factors. Then there's what is known as acquired. Acquired means that you can actually develop issues later after you're born, where you had normal hearing and then something went wrong and interfered with your hearing. Leading causes would be things like infections. Infections can really occur in childhood, as this is because your ear is still developing. So childhood ear infections tend to be more frequent because probably your middle ear, what I was saying, the pressure equalizing tube or the Stitian tube has not yet completely matured, so you can easily get infections from there. When you're younger, your immunity is not as good, so you are more predisposed to these infections. You tend to have a lot of flu-like symptoms or flu-like upper respiratory tract infections that are associated with ear infections. So recurrent ear infections just means more damage or a higher risk of you developing a hearing loss due to damage from the infection. Apart from that, acquired can be just temporary acquired hearing losses such as wax, as I said, so which we can sort by clearing. If a child puts a bean in the ear, you've already created an occlusion or a blocking that we can clear it out. There's what is known as noise-induced hearing loss, and that's what I was saying, that if you are exposed to loud volumes, you are causing wear and tear of the inner ear, and this can result to hearing losses that are irreversible. Age, as you age, there is nothing much you can do about aging, but then you know that that is a possible thing, but you can always protect your ear from other factors so that even when the age hearing loss happens, we age differently. You will see a 50-year-old looking like a 30-year-old, and you'll see a 20-year-old looking like a 50-year-old. The ear also, if you protect it, you might end up with normal hearing, with very good hearing up to old age without really having any issues with communication with people. So there's so many factors. Of course, now there is other greater things, like if you have trauma cuts across all ages, that if someone even as simple slaps you, you can easily cause damage to the eardrum. If you have trauma and you have, let's say, the bone inside the ear are injured, you can still develop hearing losses. And then there's what is known as ototoxic or drug-associated hearing losses. So these are the side effects or drugs that can cause damage to the ear.
Dr. Mambwe, on the Q&A side, do we have any questions?
Yes, we have a question. It's about the hazards of cleaning ears with antiseptic solutions or hydrogen peroxide. What are the hazards of doing this?
So when we talk about cleaning of the ear, what we say ear irrigation. So most of the time you will find that it is, and this is from studies that have actually even been done locally. You just need boiled water that is now cooled down to normal temperature. Then you can actually use the pressure, and it has to be sustained. You have to do sustained pressure, low pressure, sustained pressure, and it's able to extrude the wax. Now, there's what is known as wax softeners. So there's the commercially manufactured ones, and there are many in the market, which are given some few days before, and they usually soften the wax in preparation for extrusion. Now, when you talk about hydrogen peroxide, there is actually a concentration of it. It's not concentrated hydrogen peroxide. There's a concentration of it that is supposed to soften the wax without really causing any caustic injury. So it's not concentrated hydrogen peroxide. And it's not everyone who needs a wax softener. So when the examination is showing that the wax is soft, you don't have to necessarily put the hydrogen peroxide. However, there's what is known as impacted wax. You find that wax has been there for a long time. It has really undergone a lot of dehydration. So it's like almost like dry, hard, and stuck in the canal. Then probably you want to use a few days of the wax softeners. You might use dilute hydrogen peroxide, and then now you introduce with the ear irrigation. Now, from studies that have been done locally, there was even a study that was able to show that you can use normal saline. There was a study that was showing you can even use water and soap. But these are things that are done in controlled setup. So do not go home and start pouring water and soap, hoping for it to extrude.
Thanks, Dr. Two questions on this side for you. One, is there a connection between ear infection and tonsillitis, or recurrent ear infection and recurrent tonsillitis? And two, what are your thoughts on the new trend of earbuds or AirPods that guys use for their cell phones or their mobile devices?
Okay. So I'll start first with recurrent tonsillitis. So I would like to believe it's more of recurrent, probably adenoiditis, that would be more associated with ear infections. And when I say that, it's because most of the time there's a tonsillitis and there's an ear infection. Chances are the adenoid is infected. When you say the adenoid, remember the adenoid is a type of a tonsil found behind the nose. Lesion, it also harbors, it tends to be a good reservoir for organisms. So this organism then predispose people to infections. So you tend to find, remember I told you the Eustachian tube has not even undergone good maturity, so you can have infections cropping through that place. So it's usually more so of nasal symptoms or adenoiditis or nasal infections that would predispose you to ear infections rather than the tonsillitis on its own. Then with regards with what I was saying, like for example, the use of a lot of earphones, you really want to reduce on it. I know people want to be on earphones all the time. Remember, the more you use, it's direct stimulation towards the inner ear. And you'll tend to find people will increase volumes very high. You better just use speakerphone. There are actually people who actually prefer speakerphone than using their phone directly on the ear. It's already reducing the exposure by increasing the distance between the noise and your ear. Then the other thing is the duration of period of time you are on it. So if you can hear using your phone very well, so the point is, the less you use the earphones, the better. And there's what is known as acoustic shock, that there's some people who their work entails them using earphones at work. And when you talk about acoustic shock, it means that persistent and chronic exposure to this sound stimuli can result to, a sound sensitivity. They tend to say they have this pain sometimes that you don't see anything that is wrong with the ear. They get sensitivities to sound. You tend to find they get tinnitus that is over there. And sometimes you do their hearing assessment and everything still looks quite normal. And for them, the point is reduce exposure, reduce levels, reduce the time of period you are being exposed to noise, and give the ear a rest so that it is recoverable.
Thank you very much, Dr. Mwangi. Dr. Wambui, any questions on your side?
Yes, there's a question about surgery. Must surgery be done if I have a hole in my ear?
Now, as I said, the hole is a sequelae or a complication from the ear infections or probably trauma. And that will patch that hole. So if it's the hole only that is there on the eardrum, unfortunately, the remedy is a tympanoplasty, which is the surgery, unfortunately. And the reason for, just a second, the reason why you might see us insisting on probably closure of that, as I said, as long as you have a hole in your eardrum, you have opened a pathway that is not supposed to be open. You are already exposing your middle ear to the environment, and that should not be the case. So it creates what is known as an unsafe ear. Unsafe ear meaning that you are at risk of developing infections, which would further probably damage your eardrum more, or even increase your level of hearing loss by causing further damage to the inner ear. So you definitely want to create what is known as a safe ear by sealing that hole. The secondary benefit that would be there, which is secondary for the doctor, would probably an aim of helping to increase or improve your hearing. If your hearing is as a result of just the hole itself, we hope that when you close that ear, apart from making the ear safe, that we are returning the normal path and that you would probably have an improvement of hearing. However, if your hearing loss has already interfered with your inner ear, it is important to know that the surgery will not improve your level of hearing. And you might probably require a different way of rehabilitating you, such as a hearing aid.
Thank you for that, Doc. Another question, how often should I visit a hospital to have my ears cleaned?
So we say that the only issue with earwax is retention enough to clog out your canal. And I remember I was asked in a different panel, how would you know I have too much earwax? You getting to see wax outside here is actually a good sign, because it means that your ear is self-cleaning itself very well. Now, when you get a lot of wax and it's enough to occlude your canal, it just basically means if I was to put my finger and plug my ear, already I can be able to deduce that there's something definitely wrong on this side. So as long as you have blockage or a sense of reduced hearing, then that's something that you'd want to go and get checked. There's some people who will talk about, they feel as if when they speak, they're very loud and everyone sounds distant. Already that is a muffled effect just because of the blockage. So it's not a routinely done thing that come in after every year, let's clean, because someone can go through their whole life without ever undergoing any cleaning And there's someone who might require repeated cleaning. Every time they get a blockage, then they present. It's very hard to project that after 3 months coming, because there's some people it might accumulate after years. There's some people after a month it has accumulated. As I told you, your canals are different. The amount and quality is different. So as long as you feel blocked, get the doctor to check. If it's not blocked, if you're hearing very well, there is no symptom, then you don't have to go for cleaning. And you'll find so many people who will come in like, I want my ears clean. And you're like, they're normal. I should be seeing wax. Even if it's that little slither of brown, it's good. Yeah. So you don't really require any cleaning if there is no wax that has accumulated enough to clog out the ear.
Thank you so much, Dr. Patricia, on your side, are there any questions from Facebook?
On my side, we don't have any more questions. Thank you.
Oh, thank you so much, Patricia. So, Dr. Mwangi, a question on this side is, we talked a lot about pediatric hearing, testing the pediatric population for hearing loss. At what age should an adult start checking to see if they are experiencing hearing loss?
Okay, so there is really no particular age where you can say, now at this point, I'm 15 years, let me go for a hearing assessment. So the first thing for the neonatal screening, there is different ways. So the first thing you just want to find out is the ears hearing or not. So there's a test that can be done to just tell you whether the ear is hearing or not, something we say autoacoustic emissions. And it's just a very quick way of knowing you can hear, and it doesn't rely on the child telling us whether they're able to hear or not. So that's a screening method. And it can tell you whether it's a pass. A pass means that, yes, that ear can hear, and that's good. And if it's a fail, it means like, oh, we cannot be able to transmit that sound, and so we need further assessment. Further assessment means you need to now try to find out what are the level of hearing for this child. When we say level of hearing, it means there's what is known as conversational or normal day-to-day levels of hearing that you should be able to hear. That at least from 0 to 20 is good enough. Immediately someone has to increase the volume for you to start hearing better. It means that your hearing loss is coming in. That if someone has to really increase the volume even further, the worse are the hearing loss. So for a child to be able to know these levels, there's the test which is known as an ABR. An ABR also does not rely on the child telling us if they are able to hear. Because as I said, sound waves will eventually become something known as an electrical signal. And this test is able to follow that path, and we are able to get special patterns of waves that should be present when you are in normal hearing levels. So it means if we're not getting this pattern in normal loudness, and we have to increase the level of loudness to get the pattern, then it already tells you that this child has this level of hearing loss based on how high we had to bring in the sound to get that pattern. So that ABR is usually done for children who were able to pick that there's something wrong with the hearing from the screening, or children who parents come in and are already picking up things like delayed speech, or there's no response in terms of sound stimuli, then we can be able to do an ABR. Any child who is already able to follow instruction, there's what is known as play audiometry. That it means that if I was to tell a child, I will introduce this sound in your ear, and if you're able to hear this sound, take this toy and place it in this box. So it means this is a child who's able to follow instructions. So if this child hears the sound and I'm the one who's controlling the level of loudness, I'm able to say within normal loudness, this child is able to follow instructions. So this child is hearing well. But then if I have to really put high levels of high levels of the sound for the child to respond, it already tells you there's already a hearing loss. So there's what is known as play audiometry, where you might have to use different techniques, whether it is using play in terms of toys or giving gifts every time they are able to hear a sound and they're able to actually get back to say, yes, I'm getting the sound. You can reinforce that by giving gifts. Then any person who's able to follow instruction, let's say, for example, even as early as even 6-7 years, there's now what is known as a PTA, which one is, it's just simple. Introduce a sound, the person doesn't know the levels you're introducing, then they're just pressing on a click to say, yes, I can hear, I can hear, I can hear. Then this, you're able to know, this is normal. Are you hearing at very low, very high volume? So you're able to know the degree of hearing loss. So there is really no specific age where you can say, I cannot be tested. You can be tested, and the ENT and the audiologist is able to know which is the best test that is able to get us the results.
Thank you so much, Grace. So you practice here at our hospital. Maybe you can tell guys when you are usually in clinic for those who may want to reach out to you.
Okay. So in AR hospital based in Kiambu Road, we have an ENT clinic that runs every day, Monday till Saturday, and there's always someone in-house who will be able to assist you to be seen at any one time.
Thank you so much, Dr. Ari. So just a reminder, today is World Hearing Day, and the theme is to hear for life, listen with care. Did I get it correct this time?
Yes.
Thank you so much. So on behalf of the senior management team of AR Hospital, I'd like to thank everyone who logged into today's webinar. We're acutely aware that these webinars are meant for the general public with attendance by healthcare practitioners. If there are any topics that you believe that you'd like covered, do reach out to us on our various social media handles so that we can provide those topics and have speakers like Dr. Mwangi come and give us general education. To Dr. Mwangi, thank you so much for taking the time to take us through this topic. I don't know if I should say Happy World Hearing Day. I know that you guys, Happy World Hearing Day. I know that you guys were very busy today screening a lot of people. I think if you are here and you have someone who you believe may have some form of hearing loss, it is not too late to get them screened. You can get them screened at AAR Hospital or at any other ENT services. Please do not feel that you have to come across. Of course, if you do come, we will welcome you at our facility. So good evening, everyone. For the healthcare practitioners, you will get your CPD points via mail. To the parents, patients, providers, and just the general public, if you have any further questions for Dr. Mwangi, please feel free to ask on Facebook or any of our social media handles. Good evening, everyone. See you next week, Thursday, same time, same place.
Thank you.
Welcome.